surgery with, like, no scars and crazy fast recovery times. Sounds nuts, right? But that's what we're diving into today. The crazy future of surgery. Buckle up.
It really is amazing. This tech is changing, like everything about surgery, making it less invasive, way more precise, and a whole lot safer for patients.
Okay, so break it down for us. We're looking at, like, a podcast made for actual surgeons, right? So we get to listen in and then explain it all to everyone else.
Yeah, exactly. Think of it as like a sneak peek into the coolest, most advanced stuff happening in surgery today.
Love it. No scrubs needed for this deep dive. So what's got surgeons buzzing right now?
Robotic surgery is huge right now. But, and I know what you're thinking, this isn't some sci-fi robot doctor doing surgery by itself. It's more like giving surgeons, well, superpowers.
Superpowers, you say? Like what?
Totally. These robotic systems give surgeons greater dexterity, meaning more precise movements, smaller incisions, less trauma, faster healing. It's pretty wild.
So less cutting equals less time spent recovering, so people can get back to their lives faster.
Exactly. Think about it. Less time off work, more time for the things you love. It's a game changer.
It's huge. Less pain, faster recovery, I'm sold. But what about seeing what's going on during surgery? Like, we're way past those old x-ray machines, right? What's the tech now?
Oh yeah, light years ahead. We're talking 3D imaging here.
Yeah.
Imagine surgeons being able to see a tumor in 3D
Yeah.
before they even make the first cut. It's like having a roadmap, before you even start the trip.
And then there's AR, augmented reality. That's straight out of a movie.
It's pretty close. Imagine this. Surgeons can actually see critical info, like where the vital organs are, overlaid in real time during the surgery, so they can work around delicate stuff super carefully.
So it's like what x-ray vision, but instead of just seeing through a patient, they see these critical details exactly where they need them during surgery? That's insane.
Exactly. Less complications, better outcomes. It's a win-win.
Mind-blowing. Okay, so this next one threw me for a loop. Wearables. Like, are we talking Fitbits in the OR now?
Not exactly. But surgeons are starting to use wearables, like sensors that give them real-time data during procedures, like heart rate, blood pressure, even tiny hand tremors. It's another tool to help surgeons make the best decisions in the moment.
Wait, so the wearables are on the surgeons, not the patients, and these things are giving them feedback during the surgery. That's wild.
Yep. Let's say a patient's blood pressure suddenly changes. Boom, the whole surgical team gets an instant alert. It's all about staying ahead of any problems.
That makes a ton of sense. Okay, so we're talking high-tech stuff here, but I imagine you need super specialized tools for all this, right? Like, it's not your grandma's scalpel anymore.
You got it. It's like a chef needing the right knives. You need tools designed for these specific, delicate procedures.
Okay, I love that. So give me the details. Are we talking lasers? Tiny robot arms.
Think new materials, ergonomic designs, instruments made for incredibly specific functions. We're talking teeny cameras for minimally invasive procedures, instruments that can actually tell the difference between different tissues, even robotic arms that can move with crazy precision.
That's amazing. And it all leads to a faster recovery and fewer complications for the patient, right?
Exactly. It's about making the whole surgical experience better from start to finish.
This is all so fascinating. But honestly, how do surgeons even wrap their heads around all this new tech? Seems like you'd need, like, a whole new degree or something.
Oh, for sure. It takes time and dedication. There are special training programs, a lot of them using VR simulations, that are crazy realistic.
Wait, so surgeons are practicing complex surgeries in a virtual world before they even step into the OR?
Exactly. Like a flight simulator, but for surgeons. It helps them refine their skills and build confidence in a safe environment.
That's incredible. So it seems like it takes a whole team to make all this tech work, right? It's not just the surgeon, it's everyone in the OR.
Absolutely. You've got all this sophisticated tech that needs to work seamlessly with the existing surgical workflow. It's all about coordination, communication, and working together as a team.
It's like everyone, the nurses, the anesthesiologists, the technicians, everyone's got to be on the same page.
100%.
Yeah.
You really need a shift in mindset and a willingness to learn and adapt to these new technologies.
So speaking of teamwork, let's talk AI. Is artificial intelligence going to be doing surgery on its own anytime soon?
Not quite yet, but AI is already a major player in the OR. Think about it. It can analyze massive amounts of data, patient records, medical images, even genetic info. And it uses all that to help surgeons make the best decisions for each patient.
We're talking about a ton of data here. So how does AI actually work in a practical sense? Can you give me an example?
Picture this. AI can actually look at a patient's medical history, their scans, even their genes, to help predict if there might be complications during surgery. This way, surgeons can be proactive and personalize the surgical plan for each person.
So AI isn't replacing surgeons, it's giving them a super-powered tool to make bigger decisions and hopefully better outcomes for patients. That's amazing.
Exactly. AI can process and understand information in a way that our brains just can't. It's about making smarter decisions, more personalized treatment plans, and ultimately giving patients the best possible care.
This is really incredible stuff. But with all this focus on robots and AI, is there a risk that we lose sight of the human side of all this, like the doctor-patient relationship?
That's such an important question.
Mm.
And honestly, one we should always be asking ourselves. Because no matter how advanced technology gets, surgery is, at its heart, a human thing, you know?
It's about trust and communication and really understanding what the patient is going through.
Exactly. And no machine can replace that.
Yeah.
Being able to listen with empathy, offer support, and guide patients through their healthcare journey with compassion, those are the things that make a truly great surgeon. And no machine can replicate that.
That's really good to hear. It seems like keeping that balance between pushing the boundaries of what's possible and remembering that at the heart of it all, it's about people. That's key.
It's a conversation we can't afford to ignore, especially with how fast technology changes.
So, where do we go from here? What can people listening do to kind of stay in the loop, to stay informed about this rapidly changing world of surgery?
Honestly, knowledge is power. I always tell people, ask
Mhm.
questions, be curious, be
Oh,
an active part of your healthcare. Talk to your doctor about these advancements, see what's out there and what feels right for you.
love that. It's about being informed, being in control.
Exactly. And remember, the future of surgery isn't something that just happens to us. We all shape it together through these conversations, through careful thought, by always putting patients first.
So well said. Okay, so we've talked a lot about the present and even the future of surgical tech, but what about like the really futuristic stuff? What are researchers working on? What's coming down the line?
Oh man, the possibilities are mind-blowing. Researchers are looking into nanobots, tiny robots that could actually work at the cellular level. Imagine repairing damaged tissues with that kind of precision.
Wait, so instead of just treating symptoms, we could actually target the root causes of diseases.
Exactly. Imagine the possibilities for diseases like cancer, Alzheimer's. It's about moving from treatment to true repair at the most basic level.
Wow. It sounds like we're on the verge of a whole new era of medicine. What other kind of crazy advancements are we talking about?
Well, VR is another big one, virtual reality. I mean, surgeons are already using it for training and stuff. But imagine a future where they can actually step inside a patient's 3D model before surgery. They could visualize the entire procedure in a totally immersive way.
So it'd be like what X-ray vision combined with actually being able to walk through a patient's anatomy. That's insane.
Totally. It could change the game for surgical planning. Surgeons could practice every step, see any potential problems, all before they even make the first cut.
This is incredible. But I have to ask, with all this talk about robots and AI doing so much, is there a risk we lose that human connection? The compassion and empathy between a doctor and their patient?
That is the million-dollar question.
Hmm.
And we can't forget about it. Because no matter how advanced things get, surgery at its core, it's a human endeavor.
It's about trust, communication, understanding. Those are all very human qualities that we need from our doctors.
Absolutely. No matter how advanced technology becomes, it can never replace that human connection between a doctor and their patient. Being able to truly listen, offer reassurance and support, and guide patients through their healthcare journey with compassion. Those are the things that make a truly great surgeon, and those you can't program into a machine.
It really puts things in perspective. So, knowing all this, where do we go from here?
That's the big question, right? And I think it comes down to keeping that conversation going, as tech keeps evolving.
Absolutely. But what can our listeners do to stay informed, to be a part of this whole thing as it keeps changing?
Honestly, knowledge is power, right?
Mhm.
I always tell people, ask questions, be curious, be involved in your own healthcare. Don't be afraid to talk to your doctor about all this new stuff. See what's out there. It's your health, after all.
That's such good advice. And it really emphasizes that the future of surgery isn't something that just happens to us. We all have a role in shaping it.
100%.
Yeah.
And the more informed we are, the better choices we can make.
Yeah.
It's about working together, patients and doctors, to make sure these incredible advancements benefit everyone.
I love that. So we've covered a ton of ground today, from robots in the OR to like The ethics of AI, it's mind-blowing stuff.
It really is. And it's only going to get more incredible from here.
Well, that's all the time we have for today's deep dive into the future of surgery. Thanks for joining us for this wild ride. It's clear that surgery is changing in ways we could only dream of just a few years ago. And who knows what incredible breakthroughs await us just around the corner. But one thing's for sure, with these advancements comes responsibility. A responsibility to ensure these technologies are used ethically, responsibly, and in a way that benefits all of us. Until next time, stay curious, stay informed, and remember the future of surgery is in our hands.